What about drinking?
It's good.
Yeah?
Same as eating.
Same as eating? Do you get full or do you have any pain when you're drinking?
Sometimes my chest starts to hurt.
Congenital diaphragmatic hernia is a congenital anomaly during fetal development where the diaphragm doesn't form completely. As a result, the abdominal contents go into the chest cavity.
Because the abdominal contents are then in the chest, the lungs are smaller and the heart is actually malposed to one side of the chest, and the left ventricle tends to be small and dysfunctional.
This can affect babies' abilities to breathe, and it requires support with a ventilator, a breathing machine, and sometimes requires additional support with ECMO, which is the equivalent of heart-lung bypass.
The feeding tube itself, we have a lot of CDH babies that have it just because it takes a lot of work to breathe and eat all at the same time. It just gives you guys a little bit of a safety net just to help her along.
The Congenital Diaphragmatic Hernia Center is a unique center because it brings together a multidisciplinary team. It involves members from the Fetal Care and Surgery Center, so we're meeting families at the initial diagnosis, and we're following them through birth, hospitalization, and then discharge until they're young adults.
We have specialists from across the institution, including colleagues within our pulmonary hypertension team, our pulmonary team, our dietitians, our neurologists, our ECMO specialists, and our nursing staff.
If you're diagnosed with CDH prenatally, then we have a whole care plan and a whole team that's ready for delivery. Right after birth, a breathing tube is placed and they're put on a ventilator. We get them through the period of the most critical time in the ICU, getting them through the operation, and then out to the regular floor, which is like a mini graduation.
Providing care for the heart throughout the course of congenital diaphragmatic hernia, repair and recovery is really instrumental. As a cardiologist and as a pulmonary hypertension specialist, we deal with many of the cardiac aspects which are associated with CDH care. We use all the resources from the pulmonary hypertension service and draw on the resources of the heart center to support the heart.
We're following up early to make sure that that transition home is going okay, that they have the support that they need to get through those early weeks in transition after being in the hospital.
We are the patient and the parents' biggest cheerleaders, and we are happy to help the patients meet all of their milestones at home. She was last seen in surgery clinic with me at the end of April. Her G-tube was giving her some discomfort, so I had her into clinic. She had been doing really well on all POs for quite a while.
We have a long-term multidisciplinary clinic that looks at the patients as a whole and how they're developing, not only from a CDH perspective, but how are they growing? How are they developing in school?
Yeah, I think this is probably what this is still some effusion in that chest.
Okay.
Which that was space that was empty space before.
Yeah.
So now it'll grow into it.
Okay.
Yeah.
One of my favorite things about our long-term follow-up clinic is the long-term relationship that we have. Knowing families from birth until their child is in their mid-20s when we transition to adult care, we're able to see them thrive through it all. It's truly a gift to be able to follow patients into their adulthood.